Hi, this video talks about how you might be able to get help for your health in Australia and the Geelong area. A family doctor is called a GP, which stands for General Practitioner. A GP is the first person to go to for most health problems. They will refer you to other services if they cannot help. For example, they will refer you for blood tests or scans or when a specialist doctor is needed. If you need medicine, they will give you a prescription to take to the pharmacy, which we sometimes call a chemist. You will have to visit a GP within 3 months of arriving in Australia for your health check. You may need to go 2 or 3 times to complete this health check. You may need some immunization or medicine. Your caseworker can help you to get to your first appointment. Doctors in Australia like you to have regular checkups and make sure you do not have specific problems. You have the right to change your doctor if you are not happy with the help you are given or the way you are treated. There are many other health services. There are public and private hospitals. The public hospitals in Geelong is called Barwon Health. Barwon Health has a large hospital in the middle of Geelong and a small hospital in Corio. Public hospitals are free with your Medicare card, but you may have a long wait for help if it is not an emergency. Public hospitals provide care for people who are not well enough to stay at home and people who need a surgery. Public hospitals are the best place to go if you have an emergency or your GP is not available. There are public and private dentists. Private dentists will charge money and are not covered by Medicare. The public dentists can also have a long wait, but refugees and asylum seekers are given priority access for their first visit. Dentists provide most of the care you need for your teeth. If you need special dental services, the dentist may refer you to a specialist. Specialist dental services can be very expensive. It is okay to ask your dentist about the cost for specialist dental work. Children under 12 can get free dental care in the public system. Up to $1,000 is available for any special dental care needed for children aged 2 to 17 years. Letters are sent in the mail when their children's dental checkup is due. Optometrists are experts in eye care and provide eyeglasses and contact lenses. Medicare will cover routine eye examinations every 3 years for people under 65 and every year for people who are over 64. If there is a more serious problem, the optometrist will refer you to a specialist doctor for your eyes. The Victorian Eye Care Service (VES) will help you pay for some of the cost of one pair of glasses every 2 years. Not every optometrist offers this service, and it's okay to ask if you are not sure. It is okay and normal to feel sad or scared sometimes, but if you are feeling like this a lot and it's stopping you being able to get on with your life, then it's a good idea to talk to your GP about getting some help from mental health specialists. These specialists can help you manage your feelings and cope better, so that it's easier to get on with your life. These specialists cost money, but you can get some free sessions if your doctor refers you. There are other services you can also access on the phone and internet such as Lifeline and Beyond Blue. Talk to the Barwon Health Refugee Health nurse about this if you need more information. In Australia, both adults and children receive immunizations given at specific times throughout their life. These are free with your Medicare card. Most immunizations happen at your GP. In Australia, children must be immunized to go to childcare, kindergarten, and schools. If children are not immunized, it will affect your Centrelink payments. When you are immunized, it is recorded and the information is sent to Centrelink. Some immunizations, like the one for flu, are not compulsory, but we encourage everyone to get these immunizations as this stops the spread of these diseases. To get the best protection, make sure you have your immunizations on time. If a disease is highly infectious, like tuberculosis, there are specialists to care for you and make sure the disease does not spread to other people. Sometimes people are worried to talk about if they have an infectious disease because they worry people will blame them. But infectious diseases are so easy to catch and that's no one's fault. The most important thing is that you get treatment and get better. The Maternal and Child Health Service works with families to care for babies and young children. It is a free service. The maternal and child health nurse will monitor your child's growth, speech, hearing, and vision and refer you for help if they are worried about anything. Your maternal and child health nurse may also offer additional visits, first-time parenting groups, and link to local community activities and services when extra support is needed. There are many other types of health services in Australia. If you do not understand what a service is for or who you should speak to about a problem, ask your doctor. If your doctor refers you to a specialist, Medicare will pay for some of your visit. But if you go straight to a specialist, like a physiotherapist, without a referral from your doctor, you will have to pay for the visit. There are special services for people with disabilities. The National Disability Insurance Scheme provides disability support based on individual needs. If you need more information about the NDIS, speak to your doctor or caseworker. A prescription from a doctor is needed to buy many medicines. When you receive a prescription, take it to chemist and they will give you the correct amount and advise you how much to take. Never take more or less than the doctor or pharmacist tells you. If you think a medicine is not helping or making you feel worse or sick, you should talk to your doctor as soon as you can. Do not stop taking it until you have spoken to your doctor, as many medicines can make you feel very sick if you stop taking them suddenly. If you have a healthcare card or pension and concession card, your medicine will not cost as much. You can get some medicine for mild pain at supermarkets and chemists without a prescription. If you are not sure what to get, you should not guess. Speak to a doctor or the pharmacist at the chemist about which ones are okay for your problem. In Australia, every permanent resident and citizen has a Medicare card. When a child turns 15, they can apply for their own Medicare card or they can stay on the family one if they are still living at home. The government pays for your health care when you use this card. You will need to take it to every appointment and chemist. You need to tell Medicare if you change your address, phone number, name, or someone who is in the card leaves their family. When you need a new Medicare card or when you change any details, one will be emailed to you. When you get a new one, you should throw away your old one. Medicare will cover you for many health services, but not everything. Specialist doctors are expensive. It is okay to talk about this cost with your GP if they are sending you to a specialist. Not all doctors are free. Some doctors are free as they use your Medicare card to charge the government, and you pay nothing. These doctors are the ones that offer bulk billing. A clinic that is a bulk billing will have a clear sign. If you are not sure if your doctor is a bulk billing, it is okay to ask before your appointment. Medicare will also pay for many blood tests and some scans. If your doctor is sending you for one of these tests, it's okay to ask if it comes off Medicare or you will need to pay. A healthcare card entitles you to a free ambulance, cheaper medicine, and cheaper health service. While everyone has a Medicare card, not everyone has a healthcare card. People who have recently arrived in Australia and are permanent residents will be eligible for a healthcare card. Make sure you take your Medicare card and your healthcare card to every health appointment. Some people have pension and concession card, which helps you to get cheaper medicines and specialist services. You get this card if you get the age pension, carer payment, disability support, or some parenting payments. You do not apply for this card, it is sent to you when you are approved for these payments. If you have an emergency and need help immediately, call an ambulance by ringing 000. The ambulance is for things like heart problems, broken bones, breathing problems, or people who are very sick. Ambulance fees are free if you have a healthcare card. To make an appointment for health services, you need to call them or go to the clinic. If an appointment doesn't suit you because you have another appointment or you cannot get there, it's okay to ask for a different appointment. If you need to cancel an appointment, you should do this as soon as you can, as interpreters may have been booked and will need to be cancelled. It is important that you are on time to your appointment, or it could be cancelled. So if you are running late or cannot come, call them and they will try to find another time for you. Sometimes you'll have to wait to be seen. Please be patient. They will get to you when they can. Many health services send text message on your phone to remind you of your appointment. Sometimes they ask you to reply that you are coming. If you cannot understand this message, ask someone in the community for help. If you need an interpreter, you should be issued with a card like this one. You should take this when you make a health appointment so that an interpreter is available when you see the doctor. Sometimes it may be a phone interpreter or via video. Do not let your children act as interpreters on your behalf. Some health services might think that your English is good enough, but if you are not confident you understand, then tell the service that they need to get an interpreter to help you. Interpreters are expensive, and the health service pays for them, so it is very important that you give 24 hours notice if you want to cancel an appointment. Some doctors do not book an interpreter until the doctor is ready to see you, so you might have to wait until one is. If you have any problems with the interpreters, such as arguing with you, being rude to you, not saying what you are saying, not respecting your privacy, or using the wrong language, please tell the doctor or the specialist that this is bad interpreter by saying in English, bad interpreter. There are many GPs near where you live. GPs often work together in a clinic like this one. Sometimes it looks like a house and sometimes it looks like a shop. There will be a receptionist to check your appointment and individual rooms where the doctors can see you privately. This one is Corio Bay Medical Center. We have shown you the address and the phone number and the hours when it is open. Here are some other GPs in your area. Your first booking at GP will be made for you, but you can change GPs if you are not happy. Barwon Health North is a public hospital in Corio. You can go there if you are not able to see your GP or when you are not sure if the problem is an emergency. You do not need an appointment. It's open from 8 a.m. to 10 p.m. Friday to Monday, and from 2 p.m. to 10 p.m. Tuesday to Thursday. You can also get x-rays and other scans here. Corio Community Health Center is also part of Barwon Health and it's a public health service. It includes public dental care, counseling, stopping smoking, refugee health, physiotherapy, and more. The refugee health nurse at Corio Community Health Service provides advice, referrals, and information. If you have a problem or any questions about health services, the refugee health nurse will try to help you. There has been a lot of information in this video. If you do not understand something, please speak to your doctor, caseworker, or refugee health nurse. We hope you stay well, but we are here to help whenever this is not the case.